My name is Victoria Ramsey, and my area of practice is adult gerontology nurse practitioner, and I'm graduating this May. The meeting I attended was the 34th annual UNC Minority Health Conference held at the Friday Center. The attendance was a mix of doctors, advanced practice nurses, and other disciplines in the healthcare industry, that is, registered nurses. The annual Minority Conference was launched in 1977 by the Gilling School of Public Health and has been held almost every year since. The conference aims to highlight health issues of concern to people of color and to also attract students interested in the minority health to the School of Public Health and to UNC. Though previously the conference had been held on campus at the Gillen School of Public Health, this year it was held at the Friday Center. The keynote speech was delivered by Dr. Brian Smedley, Vice President of the Joint Center for Political and Economic Studies. From statistics and studies, I knew there was a racial and ethnic disparities in access to care, but was not aware how serious the problem was or the extent of the problem. In his speech, he covers statistics comparing access to care for African Americans, Hispanics, Asians, American Indians, and Alaska Natives. He also discussed the direct and indirect cost of the disparities. The topics that were of interest to me were those that involved me as a provider. The Affordable Care Act, recently enacted, provides healthcare providers with programs that would increase diversity and improve the distribution of providers. There are also programs that authorize cultural competence training for healthcare providers, and this is contained in the same act, Affordable Care Act. The speech was long, but the content was interesting and the speaker was very engaging, which proved the point made in Sullivan chapter 5 that it is important to pay attention to your message and how you deliver it in the process of communicating to others. At the end of the lecture, the speaker took questions, and though some of them were confrontational, he was able to answer calmly and without losing the message he was trying to convey. Reviewing his slides later in the day, I noticed how different the two mediums of message delivery were. The PowerPoint was quote unquote black and white, while his speech was clear and was occasionally punctuated with anecdotes about his work and his personal life and made the in person attendance quite different than viewing it from a PowerPoint slide. Listening to the speaker made me strengthen my resolve to learn more about healthcare policy because it does influence the way we practice and how we are reimbursed, which in turn influences where we practice as providers. In the textbook, Hamrick, quoting a report from the Institute of Medicine, mentions some reasons care to minorities is affected. Quote, barriers to access are related to a number of factors, including inability to pay for healthcare, as well as lack of availability of specific types of healthcare providers or institutions, and potentially in some cases because of provider bias towards special populations such as minorities. End quote. And this is in chapter 23 of Hamrick, page 824. Another important thing to acquire as a nurse practitioner is cultural competence. This allows the nurse practitioner to provide care with knowledge that is sensitive and care that is respectful of a patient's cultural, racial, and ethnic background. One of the strategies outlined to help achieve cultural competence in Hamrick is taking advantage of training opportunities for increasing your cultural awareness and sensitivity. Most facilities have educators who provide these who were specifically trained to provide cultural awareness education. Cultural awareness would assist us in providing unbiased care to patients, especially the minority patients. Restrictions on advanced practice nursing practice is a barrier to healthcare delivery to all, especially those who need it the most, the minorities. After the break, the participants had a choice of 4 lectures that they could attend before the lunch break. I chose to attend one that was about healthcare delivery to immigrants. The speaker highlighted the problems faced by immigrants, especially illegal immigrants, as most countries do not have policies in place for undocumented people. Overall, it is a conference that I could encourage nurse practitioners to attend. Each year, it features a different keynote speaker, and the topic each year is different. Browsing through their website and looking at some of the subtopics that are discussed in previous conferences, they have topics that are really relevant to nurse practitioner practice. During breaks, we were able to interact with other participants from different parts of the state and listen to industry news from those already practicing as providers. There were also exhibits in the hall with the different companies, including government agencies, represented, all of which were relevant to me as a graduating nurse practitioner.